COVID-19 pandemic. Let's take you to Geneva in Switzerland now.
Dr. Kate O'Brien, Director Immunization, Vaccines and Biologicals, and Dr. Soumya Swaminathan, Chief Scientist. We have also in the room Dr. Jim Campbell, Director Health Workforce, and Elizabeth Hero, our Chief Nursing Officer. Welcome all. Now, without further ado, I will hand over to Dr. Tedros for his opening remarks and to introduce our guest. Dr. Tedros, you have the floor.
Thank you, Fadila. Good morning, good afternoon, and good evening. Tomorrow marks 1 year since I declared a public health emergency of international concern over the outbreak of novel coronavirus, the highest level of alarm under international law. At the time, there were fewer than 100 cases of the disease we now call COVID-19, and no deaths outside China. This week, we reached 100 million reported cases. More cases have been reported in the past 2 weeks than during the first 6 months of the pandemic. A year ago, I said the world had a window of opportunity to prevent widespread transmission of this new virus. Some countries heeded that call, some did not. Now, vaccines are giving us another window of opportunity to bring the pandemic under control. We must not squander it. The pandemic has exposed and exploited the inequalities of our world. There is now real danger that the very tools that could help to end the pandemic, vaccines, may exacerbate those same inequalities. Vaccine nationalism might serve short-term political goals, but it's ultimately short-sighted and self-defeating. We will not end the pandemic anywhere until we end it everywhere. The world has come to a critical turning point in the pandemic, but it's also a turning point in history. Faced with a common crisis, can nations come together in a common approach? When a village is on fire, it makes no sense for a small group of people to hoard all the extinguishers to defend their own houses. The fire will be put out faster if everyone has an extinguisher and works together in unison. More vaccines are being developed, approved, and produced. There will be enough for everyone. But for now, vaccines are a limited resource. We must use them as effectively and as fairly as we can. If we do that, lives will be saved. That's why I have challenged government and industry leaders to work together to ensure that in the first 100 days of 2021, vaccination of health workers and older people is underway in all countries. My message to governments is to vaccinate your health workers and older people and share excess doses with COVAX so other countries can do the same. My message to people in countries that are now rolling out vaccines is use your voice to advocate for your government to share doses. If you're someone at low risk, please wait your turn. Health and care workers have been on the front lines of the pandemic, but are often underprotected and overexposed. They need vaccines now. They and their families have already paid an extremely high price in this pandemic. Protecting the people who protect us is the right and smart thing to do. In the early days of the pandemic, as you remember, people showed their love and appreciation for health workers by applauding on their balconies. Now it's time to show our love and appreciation for health workers by making sure all health workers are vaccinated. Today, I'm honored to be joined by two health workers who have been delivering health services throughout the pandemic. Harriet Naiga is a midwife from Uganda. Harriet, thank you so much for joining us today. Please tell us about your experience working through the pandemic. You have the floor, Harriet.
Thank you very much, Dr. Tedros. Thank you very much, Dr. Tedros, for this great opportunity. My name is Naiga Harriet from Uganda. I'm a midwife. I'm a director of Milcot. Milcot is midwife-led community transformation, which is a community-based organization, which is aiming at bridging the gap which is existing between the midwife and the local community through provision of sexual reproductive health and rights to marginalized adolescents and young adults. So I'm very practical in the community through preventive initiatives. My work is going down to the grassroots to engage with the community adolescents and young adults. However, when the pandemic came in, things changed and I could not access these groups. We could only access them via phone calls. And then when the lockdown was open, we do not have enough SOPs in the marginalized communities. And that means I, as a midwife, together with my team that I lead, we are very, very vulnerable to the disease because the communities that we engage with do not have enough to provide, to prioritize having SOPs in place. So that means we need to be prioritized when the government gets the vaccines in the country. As well as my fellow nurses and midwives whom I engage with, who are in the health facilities, because we do also engage with them as we provide them with resilience, with the knowledge and skills towards the provision of youth-friendly healthy services, but they also tell that they would love to have the vaccines as early as possible because they engage with large numbers of patients, and us as nurses and midwives being on the front line, and we engage with the patients with for more hours than any other health worker. So we need to be prioritized, and we really thank WHO for the move that you have taken on producing the vaccine. That will be very great for us, the nurses and midwives, if it comes. And I appeal to the government because of the efforts that it is putting in to have the vaccine in place. We also ask the government that when it comes, nurses and midwives are prioritized to be vaccinated first. Thank you very much.
And I hear your call that you would love to be vaccinated so that you know you're safe to protect the mothers and children you work with. Thank you so much again. Asante sana, my sister. Now to our second guest, Sana Balok is a nurse from Pakistan who started her career during the pandemic. Sana, thank you so much for joining us today. And we look forward to hearing about your experience working on the pandemic and your hopes for the year ahead. Sana, you have the floor.
Thank you so much, Dr. Tedros. Thank you for inviting me here. My name is Sana Baloch, and I'm a recent graduate of Science in Nursing from Aga Khan University, Pakistan. I actually started my career as a nurse during the pandemic, where when a student nurse transitions to a professional nurse is itself usually a challenging time where you need the best supervision and best mentorship to do your skills in a clinical side. Unfortunately, we were transit in a time where we were the only ones who had a great responsibility to deal with the patients. where most of the staff were isolated, they were infected, and they were exposed. The burden and the shortage of staff was huge, and we had a huge influx of patients. We were trained within few weeks to take care of the patients in COVID ICU when there were new units built up in a couple of weeks. So we as nurses, the doctors and paramedics were in a great distress, but yes, we had no escape. It is our moral responsibility, and it was our job to take care of those patients. We were the only hope of the patients and the families who were isolated and admitted in COVID wards, and where they were not allowed to meet or to see anybody. We cannot deny this. We cannot leave them alone, but at the same time, we need protection. We need understanding of the policymakers, our managements, and the government to protect us, because by providing the complete PPE and, of course, vaccination, because the PPE is disposable, but the healthcare workers are not disposable. So we thought that the cycle was continuous during the year. The pandemic to 2020, we were exposed, we were isolated, then we just had to wait when we will recover so we can go back and take care of our patients again in the COVID ward. So there were our colleagues who were really sick, who were not able to breathe in, but after 20 days of their hospitalization, they were there standing in the wards and taking care of the patients. Around 10,000 of the healthcare staff has been infected in Pakistan, and more than hundreds were died. And they were not old, they were young, they were our colleagues. And because of less resources, less PPE, and of course now when we talk about the vaccination, it is the responsibility of the world leaders and most developed countries to help the humanity and the healthcare providers first, to protect them so that they are able to deliver the best quality of care and they are safe in order to provide care. Because the healthcare providers are the ones who are not going to any gatherings. They are the ones who are following all the SOPs, but yet they are the most vulnerable. They have to take care of the patients. We had to give the bath. We have to take care to the clothing and everything of COVID patients and people who are on ventilators, unable to breathe. There is no escape, and we as healthcare workers, the doctors, the young doctors, nurses, midwives, and all paramedics look forward to the world that they will decide on the basis of the humanity, because it is not something as state level, it is something as a human being. And we as a world can only fight with the virus when we think of providing safe services to our healthcare providers despite of the borders. So yes, I appeal to the leaders of the world that please distribute the vaccine on equitable categories. If you have enough of the resources to vaccinate all your elderlies and all your healthcare providers, so do consider to donate or help out lesser developed countries who do not have enough to even vaccinate their healthcare providers or elders before moving towards the less vulnerable population of yours. Thank you, Dr. Tedros.
Thank you so much indeed. Thank you. That's very, very clear. So again, thank you, Sana and Harriet, for joining us today. You have my deep respect and admiration for the work you do every day to save lives and deliver health services to those who need them most. We're proud of you. And you have my commitment that we will do everything we can to ensure you and your colleagues are vaccinated as soon as possible. The theme for World Health Day this year is health equity. Equity is at the heart of everything WHO does. This week, we have released 2 products to close gaps in care and improve health outcomes globally. The first is Essential Diagnostics List, a basket of diagnostics that WHO recommends should be available at point of care and in labs to improve timely and life-saving diagnosis. The COVID-19 pandemic has reinforced the value of timely and accurate diagnostics to save lives. Without them, you're flying blind. The latest edition of the essential diagnostics list includes tests for the COVID-19 virus, expands the suite of tests for vaccine-preventable and infectious diseases and non-communicable diseases, such as cancer and diabetes, and introduces a section on endocrinology, which is important for reproductive and women's health. The second product is a new 10-year plan for neglected tropical diseases, a set of 20 illnesses that affect more than 1 billion people, most of them poor. The plan includes ambitious but achievable targets to reduce the number of people who need treatment for a neglected tropical disease by 90%, to achieve the elimination of at least one disease in 100 countries, and to eliminate 2 diseases, guinea worm and yaws, globally by 2030. Together, WHO and our partners are working together to ensure neglected tropical diseases are neglected no more. These are just 2 examples of the many ways WHO works every day to fulfill our mission to promote health, keep the world safe, and serve the vulnerable. I thank you. Fadila, back to you.
Thank you, Dr. Tedros. I will now open the floor to questions from members of the media. I remind you that you need to raise your hand using the raise your hand icon in order to get in the queue to ask your question. And don't forget, please, to unmute yourself. We welcome also questions from journalists to our wonderful guests, Harriet and Sana. So please don't hesitate to ask your question. They have the experience from the field, and it's interesting to hear from them also. I would like to start the question and answers with a journalist from Cancun, Mexico, Paulina Alcazar. Can you hear me, Paulina?
Hola, Fadela, gracias. Sí te escucho. ¿Me escuchan ustedes?
Yes, yes.
Muchas gracias. Gracias. Los viajes internacionales no cesan, van en aumento y hay un nuevo requerimiento de países que piden pruebas PCR o antígenos para regresar.
Countries would like to impose, but there is a new pressure now imposed on testing. Do you aim to prioritize the international travel sector, staff and travelers as a second priority group? Thank you for vaccinations.
Thank you, Paulina. Dr. Ryan, would you take it?
I can start. I think the question actually specifically relates to vaccinations of people working in the industry, but with specific reference to testing as a measure. Testing is being increasingly used in different parts of our society to do different things. And certainly the expansion of rapid diagnostic tests is bringing a new and very useful tool to bear, taking pressure off the existing PCR-based testing systems, and fully expanding the use of validated rapid diagnostic tests is a major aim of WHO, our partners in FIND and UNITAID, and within the ACT Accelerator. I think Bruce will confirm that. The specific issue around increased testing requirements. Countries right now are in different situations. Those countries with very low incidence are very, very afraid about re-importing cases and may have more stringent testing in place. Other countries are worried about the arrival of potential variants that will further complicate their situations, and they're targeting reducing movement from certain countries in order to be able to avoid that. It's a difficult prospect, and we do need is coherent messaging around travel requirements. The process of travel itself has been significantly de-risked, and to the travel industry and others, they deserve credit for having put in place a lot of measures to reduce the risk of transmission during the travel process. Managing the arrivals in terms of quarantine and supported quarantine, testing and other measures is difficult. And I know a lot of countries now And it's something we've been saying for many months when we're talking about dealing with either context of cases or people arriving from high incidence countries. If you are going to require that travellers arriving in the country quarantine for a particular period or have to be tested, then governments should be supporting that process. It is very difficult for a traveller arriving to be able to comply sometimes if they don't get the support to comply. So if governments are going to require that people stay in a hotel for a period of time, then those facilities that are provided should be adequate, and people should be able to do that with a minimum level of comfort and be able to live properly. So as you see, governments are continuing to try and increase and ramp up their efforts to break chains of transmission and to manage risks. But we also must do that and invest properly in those mechanisms. So not only citizens in countries, but people who are travelling between countries. And people should be able to do that with a minimum level of comfort and be able to live properly. So as you see, governments are continuing to try and increase and ramp up their efforts to break chains of transmission and to manage risks. But we also must do that and invest properly in those mechanisms. So not only citizens in countries, but people who are travelling between countries are treated with respect and with due regard to their comfort and their human rights.
Thank you, Fidel, and thank you, Mike. Thank you for the question. So on the issue of prioritizing the use of vaccines, it's an extremely important point, and thank you for raising it again. But we need to be clear, and again, the Director General spoke about the toll of this disease and the disproportionate effect of this disease on highly exposed populations in the course of their work, our healthcare workers, like we heard from Sana and Harriet today, and then also, of course, our older populations. And when faced with a life-threatening disease and what is a ubiquitous risk and threat here of this virus, we have to be extremely careful about how we use the scarce resources that we have to reduce that risk. One of the most precious things we have right now are the vaccines. You have seen in the media reports and elsewhere the struggles, the challenges companies are having just making even what they had planned to make and getting it out there on time, getting it distributed. In that situation, we have to prioritize the people, not who are inconvenienced by COVID-19, but the people who need this to help prevent them from possibly dying of the disease. And we know the people at greatest risk are healthcare workers. You just heard from two heroes of the healthcare profession right at the front line who cannot help but be exposed in the nature of the work they do. Then we have our older populations, and then we have populations with known comorbidities, as you've heard about. We need to make sure that the vaccine, this precious and rare, scarce, fortunately, commodity right now, is used to reduce the risk of severe disease in these people. And then on the issue of testing, as Mike mentioned, you will have seen just over the last couple of weeks some exciting new partnerships that are evolving to try and make sure that we can make testing, accurate testing, available on even a bigger scale. And one of the things, two of the ACT-A partners announced just last week was that they have now struck a deal to try and make a highly accurate rapid diagnostic test available for low, middle-income countries for $2.50. And so that's the kind of partnerships we're getting down now to the price ranges where we can really get testing up, like you said, Mike, to the levels it needs to be if we're going to be able to rapidly isolate, detect and isolate people who are infected with the virus to prevent that spread.
Thank you both. I would like now to call on Christian Ulrich from DPA to ask the next question. Christian, are you online?
Thank you, Fadela.
Yeah.
My question is on the expert mission in China. Can you update us on what exactly is going to be on their schedule for the weekend? Is there a visit to the Virology Institute, for example, or to the market? Thank you.
Thanks. I'd be very good if I could tell you what my schedule was for the weekend. Never mind the one of our team, and I'm sorry not to. I think you'll understand that the team is in a dynamic situation. There is a very long list of site visits planned, and face-to-face meetings continue. The visits will include the Wuhan Institute of Virology, other labs, the Hunan markets, early responders, hospitals in which the first clusters of cases occurred. It was a very busy schedule, and I also wonder sometimes the media complement of the teams is much larger than the international and Chinese team put together. It's obviously a very good thing that we have that transparency, but it's also important that we let the team get on with the business of the work they're doing. We're here to support them. We continue to support them logistically and diplomatically, and we'll continue to do so. But and again, the DG has said that we continue to be hopeful that all of the data and all of the meetings that they need will be had, and just to reconfirm that all hypotheses are on the table, and we're looking forward hopefully to a successful conclusion of the mission. But in that I would just like to caution everyone, success in the case of animal-human interface investigations is not measured necessarily in absolutely finding a source on the first mission. This is a complicated business. What we need to do is gather all of the data, all of the information, summarize all of these discussions, and come to an assessment as to how much more we know about the origins of the disease and what further studies may be needed to further elucidate that. Maria, any comment?
Just very quickly to say that the team is on the ground, and we're all watching them as you are with the media attention. So I would advise to please be careful with the team and as you are taking those pictures, because we have seen some harrowing videos of people following them in cars. But as Mike has said, the scientists are at work. Just one thing to mention, myself been on many missions for WHO. The mission team needs to decide what they do as they learn. And so they may show us a schedule, which we haven't seen, but they're working very hard to see all of the different places they want to go. They may change their mind and go to different places. We need to give them that freedom and that liberty to go and evaluate what they need to evaluate and visit where they need to visit. So we wish them very well. And as Mike said, we look forward to learning more.
Thank you. I would like now to invite Simon Ateba from Africa News Today to ask the next question. Simon?
Yeah, thank you for taking my question. This is Simon Ateba from Today News Africa in Washington, D.C. Last Thursday, WHO Africa warned that Africa was again in danger of being left behind, with only 25 people vaccinated in Guinea so far. And yesterday, WHO Africa said the new variant were pushing up death and new cases, with almost 6,200 people dead on the continent in the past week alone. Can you please give us an update on vaccination in Africa, on other new variant in the continent? When exactly do we expect serious vaccination to start happening in Africa beyond repeated promises from COVAX? And what does the WHO think about the Russian vaccine that was discussed yesterday with authorities in Algeria? Thank you.
Thank you, Simon. I would like maybe to invite Dr. Soumya Swaminathan to take part of this question. Soumya, are you online?
Yes. Thank you, Simon. And I will start, and Kate or Bruce might want to add. I think this is what is topmost of our minds, and in terms of getting vaccines to people, especially to those who are at the highest risk. We have two frontline workers who've spoken to us today. So clearly, healthcare workers and others who are at high risk of both getting the infection and dying from it need to be in the front of the queue to get the vaccines, regardless of where they live. And this takes us back to what the DG has called for already. In the first 100 days of this year, we should start seeing vaccines rolling out in all countries. Now, how do we do that? We're doing that through COVAX. And we last week announced that we had signed a deal with Pfizer which is a vaccine that has received WHO emergency use listing as well as SAGE policy guidance. It has challenges of ultra cold chain, but those can be overcome. And so we're hoping very soon in the next couple of weeks to start dispatching the first consignments of this vaccine to countries around the world that are part of the COVAX facility so that they can start vaccinating their health workers and the most high risk. We also expect to start receiving doses of the AstraZeneca vaccine. Now, currently, it is going through the regulatory review at WHO. You must have heard that the European Medicines Agency has just given it a conditional marketing authorization. We need to review the dossiers independent of that because the manufacturing sites for the vaccines that will come to the COVAX facility are different from the vaccines that will go to Europe. So we are hopeful that in the next 2 weeks at the most that this should happen, that we should have an emergency use listing, provided that everything, of course, goes according to plan and all the data is there, and that we can then start receiving doses of the AZ vaccine from the manufacturing sites in India and South Korea, and those should also be going out to the countries. Meanwhile, of course, we're working with the countries on getting absolutely ready with everything that's needed, and we've gone through that before on what are all the elements of preparedness at the country level, so that the day the vaccines arrive in the country, they can start being deployed. And there are many, many things that countries need to do to get ready. We've seen even in the high-income countries that it's not just a question of having the vaccine in the refrigerator. It takes a lot from that point to actually getting it into people at the pace at which we want to move. So February is definitely our goal. The earlier, the better. And we will try to expand as rapidly as possible through the COVAX facility. Thank you.
Thank you, Dr. Swaminathan. Now we would like to ask Dr. Simao to address the question about the Russian vaccine. Thank you.
Thank you, Fadila, and thank you for the question, Simon. WHO has under assessment at this stage 4 vaccine candidates. The 2 are the AstraZeneca derived, and just piggybacking on the issue of the EMA approval today, it's a very useful approval because it approves the core data, and the core data is useful for all the sites that are, that AstraZeneca has 8 different manufacturing sites. So WHO is at the final stages of assessing the sites that will provide to the COVAX facility, which are the SK Bio in Korea and the Serum Institute in India. We are also in advanced stage of assessment of Sinopharm and Sinovac, and at this stage we do have a team in China to do the inspections in the Chinese facilities. Regarding the Russian vaccine, we did have last Friday we had a new meeting with the manufacturers, and WHO is still waiting. There will be subsequent meetings. WHO is still waiting for some core information, some vital information to be presented, and this should be happening in the next few weeks. Thank you.
Dr. O'Brien, you have the floor.
Yes, just to add a couple of things to what Soumya and Mariangela have contributed. On the country readiness, I think what I really want to communicate is the full readiness that many countries have to get started. And yet there are countries that still have a ways to go to be prepared. In addition to that, there are choices, as has been indicated, about the vaccines that are coming through the COVAX facility, and not all countries want to proceed with some of the ultra cold chain issues that are at hand, and are making decisions about what the sort of optimum mix of vaccines will be in their program. So the COVAX facility is ready, as Soumya said, is ready to deploy vaccines in the next coming weeks, and countries are in the process of communicating and being communicated with about what those allocations will be. I want to direct your attention to the COVAX facility website, which does have now supply projections over time by region and by product. And I think those are useful pieces of information for you to draw on about what the COVAX facility is projecting to deploy.
Thank you. I would like now to invite Jeremy Lunch from Radio France Internationale to ask the next question. Jeremy, can you hear me?
Yes, thank you, Fadela. Thank you so much. Apologies if the question has been asked earlier, but I was a bit late. I just wanted to have a comment from the WHO about the recent ban, vaccine exportation ban from the European Union. Thank you.
Dr. Simão.
I'll start, and thank you for the question, Jeremy. It's a very worrying trend. We have seen last year, in the beginning of the year, when we had the first lockdowns affecting the big producer of essential medicines. We had export restrictions at the time of active ingredients for essential medicines. So this is very much a movement that concerns WHO, because we understand that no product nowadays, not WHO understand, that's the truth, actually is made in only one place. There are multiple elements. When you get a medicine or you get a vaccine, you're getting products that are coming from many places in the world. So it's not, let's say it's not helpful to have any country at this stage putting export bans or barriers that will not allow for the free movement of the necessary ingredients that will make vaccines, diagnostics, and other medicines available to all the world. So I don't know if anyone wants to complain.
All right, that was the World Health Organization panel, as it often does, answering questions about COVID-19 vaccination trends, etc. The final one there about the European Union saying that there will be no exports of vaccines. This is, of course, to ensure that European populations are vaccinated first. And there's always been a concern that this could happen, vaccine nationalism, caring for your people first, but what about equity? What about getting it out to poorer countries? A very difficult issue, because of course countries would want to vaccinate their own population if they have access, easy access to those vaccines, something that the WHO and the world is watching.